Mental health support became more accessible in North Bengaluru with the inauguration of the Ummeed Counselling Centre in Fraser Town on May 31st. The new facility was launched on Mosque Road in Pulkeshi Nagar as an expansion of the JP Nagar-based Ummeed De-Addiction and Rehab Centre, which was founded in 2023. Officials said the centre was opened in response to growing demand from patients and families in North Bengaluru seeking easier access to professional mental health services. Founded in 2023 by Dr. Asfia Khalil and Dr. Mohammad Rafiuddin Rashid, Ummeed has worked with individuals dealing with addiction, mental health challenges, and emotional distress. Dr. Rashid said the name Ummeed, meaning hope, reflects the center's mission to support people who feel they have run out of options. The center offers psychiatric and psychological care for adults, children, couples, and families.
There is a small poetry where, this is the season of results, where you are covering a lot of events where toppers are garlanded, toppers are like praised, isme topper, and what happens to people who have failed society, who are considered thorns of this society. They are considered kante, not phool, kante. So somebody has to take care of those thorns also, right? Can we just consider thorns and remove them from society, eliminate them? No. We cannot eliminate them. We have to embrace them. We have to take care of them. Somebody should embrace them and bring them back to society. The drug addicts, the depressed people, the people who are traumatized because of some event in life. It could be some horrible rape, it could be some traumatic passing of a kith and kin. Who will take care of them? Ummeed signifies hope for people who have lost all hope. We bring them back to life, we bring them back to society. We want them to become positive, productive members of society. So let me finish with a small couplet. फूलों को तो सरखूब चढ़ाता है ज़माना. Fool, people who are successful, everybody praises them. See, this fellow has done so good in NEET. He's becoming a doctor. This fellow is becoming an engineer. He's a scientist. He's so and so. We never talk about people who are caught doing drugs, who are caught in some other illness. What to do about them? Ummeed stands as a beacon of hope for people who have apparently failed society. फूलों को तो सरखूब चढ़ाता है ज़माना, है कोई जो कांटों को भी सीने से लगाए. From this particular couplet started the idea of Ummeed for people who have failed society. Let them not be called as failures. We'll try to bring them back to life. Believe me, a mother calls us and says, मेरा बच्चा मेरा कुछ गला दबाने आ गया था. He's trying to kill me. Please help. That's where Ummeed comes. I would like to finish with these words. Do not hesitate to call a psychology partner, a psychiatrist. A helpline could be by NIMHANS, it could be our helpline. Do not hesitate. Help is just a phone call away.
Services include counseling for anxiety, depression, trauma, addiction, and marital issues, among others. It will also conduct developmental and learning assessments for children, along with training programs for teachers, parents, and mental health interns. A unique feature of the center is its focus on culturally relevant care. Clinical Director Sulekha Shakur Razani said faith-based approaches, including principles of Islamic psychology, would be integrated where appropriate to help improve comfort, trust, and relatability for people from Islamic backgrounds.
तो जब हम इस्लामिक नुक्ते नज़र से कोई केस को देखते हैं, कोई मसले को देखते हैं, तो उसमें अल्हम्दुलिल्लाह कुरान, सुन्ना, हदीसों से हम काउंसलिंग करने की कोशिश करते हैं. जहाँ पे अगर एक मियाँ बीवी के बीच में अगर कोई झगड़े हो, या अगर कोई हम और गम डिप्रेशन से सफ़र कर रहे हो, या अगर उनको बहुत हैबत एंड एंजाइटी वाली सिम्टम्स फील हो रही हो, तो उसको हम इस्लामिक नुक्ते नज़र से देखते हैं, कुरान और हदीस की रोशनी में. क्योंकि नसीहत जब होती है तो अगर वो जब हमारे इस्लामिक तौर से नहीं होती है तो उसमें काफ़ी डिस्कनेक्ट फील होता है, वो रिलेटेबिलिटी कनेक्टिविटी भी नहीं हासिल होती। तो अल्हम्दुलिल्लाह हमारा एम है कि इंशाल्लाह कम्युनिटी एंड बाहर भी इंशाल्लाह जो भी आएंगे उनको हम इस्लामिक तौर तरीके से इंशाल्लाह कुरान और हदीस और सुन्नत की रोशनी में इंशाल्लाह उनकी नसीहत, उनकी रहनुमाई और उनका काउंसलिंग उस तरीके से हो इंशाल्लाह।
With a multidisciplinary team of psychiatrists and psychologists, the center hopes to bridge gaps in mental health care and bring support closer to communities that need it most. Ummeed's founders said the aim was to make mental health care more accessible, professional, and culturally sensitive as awareness and demand for mental health support continue to grow.
Yes, these kind of institutions are very important where we have inclusive therapy. So it is for all communities. So we will be catering to everybody in the society. Whoever has mental health issues, we will be dealing with them with utmost care and with expertise. So this will be OPD center where they can come and take consultation and they can come and do the test for drug screening, and if they are found positive and they need to be admitted, we will be admitting them in Ummeed De-Addiction and Rehab Center. So we have the admission facility there and only the counseling and the OPD facility for mental health cases here.
There's this big misconception amongst people, and before we go to psycho specifically, the stream of psychiatry and psychology, most people don't differentiate between the two. Psychiatry is specifically medical science that deals with medication and treatment towards mental health issues, right? Psychology is a subject that's a study of human behavior. Now, this is basically applying the science into the same aspect of treatment, and it does not involve medication. So when you take a medicational part, it becomes psychiatry. When you take a therapy part, other than medication, that goes as psychology. Unfortunately, the term psycho, it's a misnomer, wherein psychosis is a symptom in psychology and psychiatry, both you might elicit it. And that word has become as a synonym with mental health. Now, if anybody is termed as a mental health patient, pretty fine, but then terming him psycho is very wrong, and it's unfortunately putting him in a degraded way. Whereas a person could be a mental health patient and an overachiever even that you may look up to.
What's your role in Ummeed?
So, fine. As in Ummeed, I am one of the doctors. I, in fact, lead the clinical side. So what happens is there's a team that looks into the medication and the treatment side, apart from the management and the other overall aspects. So the treatment side of the patients, I lead that. So I have to involve myself with the therapy from the psychologists and taking the input from the psychiatry with the doctors, as well as using my judgment to see what is the position of the patient. Therein advise the admissions, discharges, and further management of the patient.